The staffing shortage in healthcare settings is a problem that isn't going away. Just yesterday, this urgent care center here in Brampton was forced to shut down a few hours earlier due to staffing issues. Medical professionals say closures like this may be happening more often if action isn't taken.
They tend to develop work burnout in those situations, become ill or unwell themselves, have to take care of themselves, and so we see increased absenteeism. And then eventually they start to leave their jobs to find a job somewhere else.
The urgent care center at Peel Memorial was forced to shut down a few hours earlier yesterday due to human resource challenges. Last week, there were warnings about repeated emergency department closures at Ontario hospitals, particularly in smaller communities, due to the same reason.
We're finding it more and more difficult to hire sufficient physicians to deal with the patients.
The Canadian Association of Emergency Physicians says they are seeing record resignations of healthcare workers, which also worsens wait times and acute care hospital access. Worrisome as Ontario experiences another COVID wave and hospitalizations rise.
People are working with half and 2/3 of their usual staff complement, and sometimes worse. And sooner or later, you can't keep all of the areas in your emergency department open that way. Because beds are not really beds, beds are nurses. And if you don't have sufficient numbers of people to take care of the ill that are there, then you have to close areas.
President of the Registered Nurses Association of Ontario, Claudette Holloway, says attention needs to be focused on recruitment and retention to ease the load on healthcare workers.
They are extremely stressed, that they are facing burnout. They feel like they're not valued.
Holloway adds she wants the province to fund more post-secondary programs to bring in more nurses.
How can we help do bridging programs? People who have worked for years as personal support workers want to move into the registered practical nurse program. Registered practical nurses want to move into the RN program.
In a statement, the Ministry of Health says it has 2 programs to provide staffing relief to hospitals, and it plans on expanding undergraduate and postgraduate positions at medical schools. At Peel Memorial in Brampton, Maleeha Sheikh, City News.